Douglas Adams is my favorite author. I often find parallels between his writing and my life. And this particular quote, "I may not have gone where I intended to go, but I think I've ended up where I needed to be," relates to the story of a project I've been working on for the last 6 years. I'm a professor in the sociology department here at Coastal Carolina University. I'd like to tell you the story of a project that was supposed to last a semester and has ended up lasting 6 years. In 2016, my colleague, Stephanie Southworth, and I decided we would like to design an experiential learning exercise to help our students understand homelessness as a social problem. Homelessness is a serious and chronic social problem, both nationally and locally. It's estimated that there are over 500,000 homeless individuals in the United States and at least 1,000 in the county in which our university is located. Our plan was to have our students volunteer at a local agency that serves the homeless community and interview people experiencing homelessness about their unmet needs. Using information from the interviews, Steph and I would help our students organize a little fundraiser to purchase the needed items. Quick and easy. Well, it did not go as planned. 6 years later, we're still working on this project. We're like passengers on the SS Minnow who thought we were going for a 3-hour tour and ended up living on Gilligan's Island for years. To date, Steph, I, and our students have volunteered thousands of hours at agencies that serve the local homeless community, and we've interviewed over 250 people experiencing homelessness. I'd like to tell you what we learned from those interviews. The first thing Steph and I learned was that we had a lot to learn. We thought we knew a lot about homelessness, but we knew a lot less than we thought we did. We expected that when we asked people experiencing homelessness what they needed, they would tell us they needed everyday items like socks or deodorant. We were wrong. We learned that homeless individuals who are interacting with at least some social services are able to meet most of their basic needs. They're able to get food when they're hungry, obtain everyday items, find a place to bathe, obtain clothing, have the opportunity to wash their clothing, get medical treatment when they're sick, and deal with feelings of depression. They told us what they really needed were jobs that paid enough to afford rent, adequate public transportation, and affordable housing. But let me tell you what we got right. We asked people experiencing homelessness what they needed. As Rick points out, this doesn't happen very often. We learned that homeless individuals are rarely asked by social service providers or social scientists what they want or need. Our initial interviews gave us insight into the critical needs of the homeless community from the perspective of the homeless community. Steph and I decided we would continue conducting interviews focusing specifically on barriers to securing transportation, housing, and employment. I'd like to tell you what we learned about how lacking adequate transportation affects people experiencing homelessness and what we did about it in our community. The people we spoke with kept telling us they couldn't get where they needed to go. They had trouble getting to work, going to look for work, going to social service appointments, medical appointments, church, recovery groups, or even the library, which provides access to computers. When asked if finding transportation was a problem, 67% of the folks we spoke to said it was, and 34% said it was a problem for them every day. 61% of the people we spoke with walked where they needed to go. This can result in homeless individuals spending a disproportionate amount of their time accomplishing everyday tasks. We spoke to folks like James, who told us that lacking adequate transportation was a barrier to securing employment. We also spoke to folks who lost their means of employment and subsequently lost their jobs. Most of the folks we spoke with agreed with Martin that the bus system, the only public transportation in our area, was not adequate. They told us they often didn't have fare money, but even when they did, the routes were too infrequent. There were not enough routes at night, and the routes did not take them the places they needed to go. We learned that the shelter provided bus passes and had a van to take residents where they needed to go. The residents told us this was not enough. They had trouble getting passes and rides from the shelter staff. There were also folks like Robert who wanted to use the van to go look for work but couldn't use it for that purpose. The van could only be used to go to specific destinations like a job interview or a doctor's appointment. Moreover, the van needed to be reserved 24 hours in advance, and lots of folks did not know their travel needs that far ahead of time. Steph and I decided it wasn't enough to know about this problem. We needed to do something about it. We investigated how other cities were dealing with transportation issues in their community. We found several examples of bike share programs. So we presented our data and a proposal for a bike share program to the staff at the shelter. They readily agreed to work with us. Working with case managers, we designed a program in which residents could borrow a bike for a day or a week to get where they needed to go. They could go looking for work, to the store, or even the beach. We call this program Rolling Forward. We had a program in place, and now we needed bikes and supplies. So we wrote grants, and our students held fundraisers to purchase helmets, bike racks, and locks. We've started a Facebook page and put a call out for bikes. The community responded, and we received 20 bikes donated from the community. A public safety officer at our university offered to give us the bikes that students abandon on campus when they go home for the summer. In July of 2018, public safety donated 70 bikes to the Rolling Forward program. The Rolling Forward program has been in place for almost 4 years now. And as you can see on the slide, the bikes are well used. Almost half the time the bikes are borrowed, it's work-related, which is not surprising because 35% of shelter residents work. A pleasant surprise was the number of residents who used it for stress relief, like Donnie. Since the inception of the program, we have seen a 30% reduction in the number of shelter residents who identify transportation as a problem. The shelter staff have been so pleased with the program, they've offered to fund it and have invested in new bikes and supplies. Steph and I have been able to help 3 other agencies that serve the homeless community start their own bike share programs. Steph, I, and our students continue to support all of these programs. Our students have been an absolutely integral part of the Rolling Forward program since its inception. Students in our classes are required to volunteer at a local agency that serves the homeless community and interview people experiencing homelessness. While many participate solely because they're required to, most report positive outcomes as a result of their participation. They tell us this was a life-changing experience. They've come to have a better understanding of the structural factors that impact homelessness and the struggles faced by those experiencing it. They believe that this experience is going to benefit them as they move forward in their academic and professional careers. Based on surveys and a qualitative analysis of their coursework, we found that 50% of students, like Lisa, moved away from the perception that homeless individuals are solely responsible for their plight towards recognizing the structural factors that contribute to homelessness, like lack of adequate housing, lack of living wage jobs, lack of adequate public transportation, the criminalization of homelessness, and inadequate access to medical and mental health care. We found that 50% of students like Paul and Kayla had changed perceptions of people experiencing homelessness. They moved away from thinking that all homeless people were lazy, uneducated substance abusers. They expressed surprise that the shelters were safe, clean, pleasant places, and the residents were people much like themselves. 47% of students, like Connor, told us that this was a life-changing experience. Prior to taking this course, many had never knowingly interacted with a homeless individual, and they felt this experience gave them a much deeper understanding of the struggles faced by people experiencing poverty and homelessness. One of the goals of this project was to help our students develop the skills and drive to be advocates for disadvantaged populations and social change. Steph and I were so pleased that 36% of our students, like Haley, were inspired to continue working with the homeless community after the course ended. The Rolling Forward program is a result of a collaborative effort between homeless individuals, community members, social service providers, and university students, faculty, and staff. Prior to our students asking homeless individuals about their unmet needs, transportation was not recognized as a barrier by social service providers in our community. Not only does the Rolling Forward program help homeless individuals get where they need to go, it's been a vehicle for Steph and I to educate our students in the community about the multifaceted nature of homelessness and the struggles faced by those experiencing it. So, well, Steph and I intended to hold a one-and-done, quick and easy fundraiser, and we ended up running an organization that serves the homeless community. I think we ended up where we needed to be. Thank you.